Anatomy of Training! Physio.
Hey guys, welcome to Anatomy of Training. I'm Kush the physio. Today I thought I'd use Elvis the pelvis, my model here, to help explain discogenic back pain and why certain positions may aggravate you a little bit more. So has anyone ever told you that you've got disc-related back pains? Maybe it's a disc herniation, a disc bulge, and what does that mean? So if we have a look at the spine, you'll notice these bony bits, they're called the vertebrae. Between them we've got the disc, and sometimes you can get some protrusions which usually tend to come backwards, that are called disc bulges, disc irritations, disc herniations, depending on the severity of them. Now these don't always matter, but sometimes, especially in the acute cases, so if it's just happened, you've just injured yourself, certain positions tend to aggravate it more. Let's take a look at a disc bulge. So on this spine, you can see this red protrusion coming out. This is mimicking a disc bulge. So on this spine, it tends to be more towards that right hand side, but depending on each individual, it can be more towards the back, more towards the left, more towards the right. There's countless options. So let's have a look at the spine and the different directions of your facet joints, which are these side joints in your vertebrae. You'll notice that through your mid sort of spine, that these joints are facing a more horizontal direction, which means you'll get a lot of rotation between each joint. It tends to be up to 13 degrees from each joint, whereas if we have a look at the lumbar spine, so your lower back, those facet joints are pointing downwards, so in a more vertical direction. And if we have a look at the amount of twist, not as much as that thoracic spine, and it only tends to be about 1 to 3 degrees per segment. So when we look at rotation, most of the rotation should actually come from your mid back, not your lower back. And that can be a reason why stiff mid and upper backs can predispose to lower back injuries. Because if we have a look at that joint again, and for some reason, because of stiffness, you're not moving so well into rotation up here, when you turn, you might be forced to rotate at a lumbar spine joint. But if we have a look at the anatomy, it doesn't actually let you rotate. So what can sometimes happen is we can get an irritation in the disc, and that can lead to a disc injury. Let's take a look at bending forwards. So there might be some rotational dysfunction going on around this area as well, and for a number of reasons, including what we just went through, you might find that a certain segment might be loaded a bit differently than the others, and that may be a reason that that segment has that injury as opposed to another one. Let's take a look at this McKenzie based extension. Essentially moving into extension, which is the opposite of bending forwards. Lying down on our stomach, you can put a lot of weight through your hands, and we're going to press up and take our back into a backwards bend. And while we're doing this, most of the pressure is going through our hands, and we're just taking our back into that position and coming back down. Coming up and back down. Up and back down. And we can actually do that about 10 times. Another progression for this is if we come up onto our hands and we can get further into a back bend and back down, back up and back down. And you will actually notice that if you're in a lot of pain and your back doesn't like a lot of movement, you might want to stay on your forearms. But if you can tolerate it, try going onto your hands and pushing up all the way. Let me know how you go. And before I let you go, how have you hurt your back in the past? And have these exercises been beneficial for you? Comment below. Thanks. See you next time.